Hello and welcome, everyone. My name is Halima Gikandi, and I'm the Africa correspondent for The World, and I'm normally based in Nairobi. And this is a live-streamed Q&A about the coronavirus pandemic in Sub-Saharan Africa and the deepening crisis that we're seeing there. Joining me today is Wafaie Fawzi. He is the Richard Saltonstall Professor of Population Sciences, Richard Saltonstall Professor of Population Sciences, and Professor of Nutrition, Epidemiology, and Global Health at the Harvard T.H. School of Public Health. You can post your questions for us on Facebook at Forum HSPH or at PRI The World, or you can email them to the forum at hsph.harvard.edu. And I'll just repeat that one more time. If you want to email any of your questions, you can send them to theforum@hsph.harvard.edu. This Q&A is jointly presented by the Forum at Harvard's T.H. Chan School of Public Health and The World from PRX and GBH. Now, Wafaie, from the start last year, the coronavirus pandemic, many African leaders acted very quickly to slow the spread of the coronavirus through lockdowns, curfews, school closures, and other restrictive policy measures. And it seemed to have worked at the beginning. It looked like Africa had been spared the worst of the pandemic, especially when you compare it to the rest of the world. But today, the situation looks very different. Sub-Saharan Africa is now contending with a third wave of COVID-19 as the Delta variant spreads and vaccine availability lags. Now, keeping in mind that there are more than 50 countries on the continent, broadly, what is the coronavirus situation in Africa right now?
Great. Thank you so much, Halima, and nice to join you in this conversation. As you noted, currently, there is a significant rise in the number of cases in many countries around Sub-Saharan Africa. The caseload as of the middle of July is about 6 million. Approximately 150,000 deaths have been reported. Now, this varies a lot from country to country. As you said, it's really 54 countries that we are talking about. A significant part of the burden, almost 50%, has been reported from the Republic of South Africa. But high burdens have also been noted in Uganda, Democratic Republic of the Congo, Zambia, and others, largely attributable, as you have also noted, to this Delta variant that's very aggressive, more transmissible, and the woefully low rates of vaccination that one notes all over the continent.
And I mean, one thing that I've always been noting as a reporter in the past year covering Africa is, even though, as you mentioned, the caseloads are increasing, when you take a country like South Africa, still I think now the mortality rates from COVID that are known is 70,000 lives, which is still a lot. But when you compare that to a country like the United States, it looks like very small in comparison. That said, one thing I found as a reporter is that the impact of COVID, you can't measure that on mortality rates alone. One thing that's incredibly interesting is kind of how you measure that. And you've been working with colleagues from the Africa Research, Implementation, Science, and Education Network, or ARISE, to look at exactly that, to study the broader impact of COVID-19 in the region. And I'd love to hear a bit more about what your findings have been.
Thank you. You're right. The direct impact of the pandemic is much less than what was feared at the outset. There were estimates that put it at perhaps between 300,000 to 3 million deaths could happen in Sub-Saharan Africa, largely attributable to the weak health systems. The numbers, as I mentioned just now, is about 150,000 deaths, which is still a large number, but much lower. Some of that could be due to variability in testing. I don't think we have really the exact number, accurate assessment of cases or deaths. There are other hypotheses out there that perhaps Africa is a younger population, perhaps there is a lower prevalence of comorbidities like obesity and cardiovascular disease that was responsible for a higher cases and severity of cases in Europe and the US. But these are really speculations. It is likely underreported. It's probably not grossly underreported. So it's still, by and large, spared much more than other regions. Although, as we noted with the current third wave, the numbers are ticking up very fast. As you said, a lot of the impact is indirect as well. And you referred to the study that we have done. It's essentially a series of surveys that we have carried out. When I say we, it's our team here at the Harvard School of Public Health and the Harvard Center for African Studies with partners on the continent. We worked at this first stage in 3 countries, in Burkina Faso, in Nigeria, and in Ethiopia. And essentially did community-based surveys among households, heads of households, among adolescents and young people in those households, and also surveyed healthcare workers. And did that in both rural and urban settings in all countries. And the main sort of takeaway is sort of the notable disruption of livelihoods in these communities. A significant increase in food insecurity and malnutrition, significant disruption of health services, particularly preventive services, that have a major impact on the current health of populations, but also likely impact for many years to come.
And I mean, education is incredibly important because one thing a lot of people don't realize is that, I mean, sometimes I call Africa the world's youngest continent because when you take most countries, the school age population is so large when you compare it to older countries like the United States or even in Asia, China, or Italy and Europe. So, what are the long-term impacts of kind of these this impact when it comes to school closures, et cetera, on children?
Yeah, there is a large population of young people, as you said. Unfortunately, school attendance is not universal, and it varies from country to country. So if one talks about primary school education, perhaps in the range of 60, 70, 80% and rising over the years. Secondary school education is much less, perhaps about 40 or 50% in various countries. But still, schools are an important source of services for a large sector of the population. And with lockdowns that have been put in place as a means to control the pandemic in many countries, schools had to be closed, in some cases for months, in some cases a whole year, academic year has been lost for these sort of young people with major really impact. One really loss of education, which is a major constraint, and worries that for many of these children, as the schools open, many of them may not and do not come back to school. Sort of really the opportunity for them to, through schooling, advance and have a lifelong sort of economic prospects for them and their families is lost as a result of these disruptions. So beyond education, schools are really an important source of many social protection systems. Food supply is an important source of nourishment for school-going kids. School meals are ubiquitous in many countries. One can discuss quality and quantity. It's not optimal, but still it's an important source for many young people. And that has been lost. And then with school closures, that really opened the door for many unfortunate incidents of increased child labor, early marriages for girls, opportunities for transactional sex. It is unfortunate that leads to a rising tide of teenage pregnancies. And this has exacerbated gender inequities that one has seen some emerging improvements on in the past few years.
Mm-hmm. I mean, exactly. And all of the point examples you mentioned, unfortunately, I have seen as a reporter in Nairobi in terms of the impact of children being out of school. I mean, when you compare it to, let's say, the US, we saw a number of educators at least attempting to move schools online. And I heard a few examples of that in Nairobi, at least for especially upper middle class Kenyans. But what have you found in terms of kind of remote education or any other type of substitute to address kids being out of school?
Yeah, unfortunately, that opportunity for sort of virtual education has been very, very limited in much of the African region. Um, we have been fortunate in other settings, talking about the US and other settings where there was almost overnight that ability to transition to Zoom and other social media to enable continued education. That has been really disrupted in many of our surveys and other surveys that have come out since then. Kids have not been able to access education through these virtual means.
And here I have a great question from Sylvie. She said, there were already deep inequities in parts of Africa, for example, South Africa. How has the pandemic worsened these inequities, such as poverty levels and access to food? So following up on that, what when it comes to things like food, what has the impact been in Africa?
A major hit really on food systems, but broadly speaking on inequities that you have noted in the questioner has noted. Even if we talk about schools, as you said, there was limited access to virtual education, but really more for upper to middle class communities, even in Africa, but not for the larger segment of the population, really widening that inequity. When it comes to food and nutrition, there has been a significant disruption of food systems. In many of our communities that we have sort of examined, food production has been reduced. Smallholder farmers is really the predominant mechanism for growing food and having access to food by many communities. About 70–80% of food produced is through these local production at the household level. And a lot of that is really run by women. So sort of, again, hardly hitting that element of food access. But also disruption of markets and transportation systems that prohibited transport of food, even when it was produced, prohibiting its transport to markets, prohibiting access by those who can afford it to markets to buy sort of a diverse supply of food. So border closures has been a significant concern as well that has blocked the importation or exportation of staple foods like wheat, maize, and rice, altogether really significantly reducing the quantity of food that's available to women, children, and households, and the quality of food. And that has really resulted in a rising prevalence of food inequity, food insecurity, and actual malnutrition.
I mean, when you talk about the border closures, that resonates with me a lot because anyone who's living on the continent has to be prepared for a sudden closure and make sure that they're in the country they need to be before flights are stopped, et cetera. I mean, you mentioned that food not getting to where it needs to be. What has the impact been on, especially countries or areas that deal sometimes seasonally with food insecurity?
And that's an important resource, really. Markets are an important source of food for households. Many times, communities or households would grow in a small plot of land around their house, and then are able to sell some of that, get cash to be able to purchase other sort of staples or fruits and vegetables that enables them to diversify their diet and have a better quality diet. So with the disruption in markets and ability to access those markets because of the supply chain, that has really severely affected many communities. In East Africa, for example, I know where you're based in Nairobi, it's estimated that 3 out of 4 individuals are at current risk of food insecurity, which comes really, unfortunately, on top of an already dire situation. Many of these communities, the pandemic comes at a time where climate change has affected rainfall, has affected food production. In East Africa, again, Nairobi, Ethiopia, there was a major onslaught of locusts that have really decimated the harvest in many settings. So it is really a compounded impact of the pandemic that has severely affected communities.
Yes, the locust. I also reported on those in Kenya, going into farms and people just trying to get them out of their yards. I mean, of course, we talk about food and diet. You know, broadly, that also has to deal with health and people's health outcomes. Based on your research, how have you seen kind of broader health infrastructures impacted by the COVID mitigation policies?
There has been a significant impact, really. On the one hand, the direct management of cases has been largely unavailable, one could say. The ability to have access to ICU beds is quite challenging. Many communities have limited access to basic supplies to treat patients with COVID-19, particularly severe patients. If one talks about respirators or ventilators, these are really a rare commodity in many settings, except in small tertiary private hospitals or small numbers in public hospitals. Respirators, as an example, there are several countries in Africa that do not have a single respirator. A country like South Sudan that has only 4, Sierra Leone about 13 were estimated. So supply of oxygen and medications for management, antivirals or steroids that are part of the normal standard of care for patients with COVID-19 in Europe and the US are unavailable. So as an important sort of investment has been in focusing on prevention. And that's the right thing to do in many countries. But unfortunately, that has been also severely disrupted. If one talks about childhood services, health services, or maternal healthcare services, these have been severely affected. It's estimated that about 40% of child health services have been affected in much of Sub-Saharan Africa. And that includes things like vaccination, not COVID vaccines, but the routine vaccination that's available to children. Vaccines against measles, polio, pertussis, which causes whooping cough, or tetanus. Many of these that are routinely available and in many settings that have been a significant improvement in access, up to 80–90%, thanks to government's input, UNICEF, WHO, and others, have been severely affected. Partly because of the disruption in the supply chain, making them available to communities. Partly because health facilities have been arranged so that they can focus on COVID-19 and sort of to the detriment of routine preventive and life-saving services. And partly because of the lockdown, or even when it is lifted, communities tend to shy away from health facilities out of concern that that might be a place where they might acquire the infection.
And before we move on, I just want to reintroduce myself. My name is Halima Gikandi, and I'm the Africa correspondent at The World. And I'm here with Professor Wafaie Fawzi, who's Professor of Population Sciences, Nutrition, Epidemiology, and Global Health at the Harvard T.H. Chan School of Public Health. And we're talking about coronavirus in Africa. Now, I just want to follow up on a question, on a point you raised about child vaccinations. And that reminded me how a number of countries, like Kenya, where I'm based, but also many others, actually do have a lot of experience in terms of their child vaccination policies, or rather infrastructure, and also actually dealing with pandemics like Ebola in West Africa, or other pandemics in East Africa. Even when it comes to border control measures, I've crossed the land border between Uganda and Kenya on foot multiple times, or even entering different countries and seeing that there, in some ways, are these robust experience in dealing with prior pandemics. And that actually leads to a question we've gotten from somebody in the audience. Let me just find it. The question comes from Mark. He said, in some ways, as I was saying, areas of Africa have more experience in dealing with highly contagious, deadly outbreaks, such as Ebola, than many other parts of the world. So his question is, what can other countries learn from Africa about how to contain COVID, especially when vaccine access is either limited or delayed?
It's a good question. There has been, unfortunately, other instances that led to experiences. Ebola is one, definitely West Africa and in the DRC. HIV/AIDS has been an important part of the burden of disease. TB, another communicable disease. And there has been a lot of investment in managing these conditions, enhancement of laboratory services, putting in place surveillance systems that enable early detection and management of TB and HIV and Ebola more recently. Unfortunately, these have been affected, even though there are lessons have been learned. And again, it varies from country to country across this large continent. But there has been significant disruption of these services for HIV, TB, and malaria that have contributed to a rising tide in new cases. And those who do have TB or HIV were unable, in many instances, to access the regular supply of the life-saving medication that they have. But one of the lessons really that can be considered is, as many countries in Africa are doing, and there are many wonderful examples of success. It's not all bad, really. There are many wonderful efforts in countries like South Africa or Rwanda or Senegal. There are significant efforts, and others, to be fair. Really investment in strengthening the health system, ideally before an emergency or a pandemic happens, that contributes to universal health coverage as a target called for by WHO, strengthening health workers, supply chains for drugs, and so on. And that has been the case in Rwanda and in Mauritius before the pandemic and during the pandemic itself, sort of applying many lessons from prior experiences. Another effort that was really important and is commendable is sort of the leadership that has been shown in some countries, where at the highest level within some countries, from the president downwards, there was leadership in putting in place a rigorous response that was transparent, as well as providing for investments and resources that are necessary to address many of these challenges. There are many examples, really, providing a safety net for poor people, actual food or cash that is necessary for enhancing their livelihood as they go through this rough patch.
Okay, so you have seen kind of some policy examples to mitigate the effects of kind of the initial policy decisions when it comes to COVID.
Yes, certainly.
I mean, going to that point, COVID across the world has presented challenges, but also opportunities, some of which you've just mentioned, to improve either health systems, food service systems, et cetera. We have a question here about, we had a question about coordination from Alia. To what extent are countries of Sub-Saharan Africa working together to coordinate their responses? Because of course, more than 50 countries, many are connected. What happens, a lockdown in Uganda impacts Kenya, impacts Rwanda, similar case in West Africa. It's hard really to separate any country when it comes to their experience during pandemic. So have you seen any type of coordination when it comes to some of these positive policy decisions?
I would say yes, and really significant coordination led by the Africa CDC, the Centers for Disease Control, based in Addis, but with regional centers around the continent, was barely established in 2017, but has really risen to the challenge, and it is under the African Union, and the heads of state for all 54 countries has been really leading the charge in providing technical assistance to individual countries, right from the first case reported in February of 2020. Strengthening capacity for supply chain, pooling orders for diagnostics, leading the charge around vaccine access and availability. So in a big way, Africa CDC has a lot to its credit in that regard.
And going off, you mentioned vaccine availability. There's been a lot of discussion globally about vaccine inequity. I've traveled outside of Africa and seen how easy it is to walk into a CVS or pharmacy to get your COVID vaccine. But when I was in Kenya, I got my first shot, and there's a lot of concern, will I get my second? And I know a lot of people who haven't been. But kind of broadly, one, what is the vaccine situation in Africa today? And two, kind of back to that question about coordination, is that something that's being coordinated at the continental level? And could you just give us more information on that?
Yeah. Unfortunately, the situation with vaccines is far from optimal. Africa, sort of the whole of Africa, unfortunately, is at the back of the vaccine queue, so to speak, with a population of 1.3 billion, only 2% of the population has been vaccinated, sort of woefully low, with some efforts to scale that up. And the expectation is that by mid next year, 2022, perhaps 20 to 30% of the population would be vaccinated. But even that, modest as it is going to be a challenge. There are efforts led by the Africa CDC working with the COVAX mechanism at WHO really to avail countries with a larger amount of vaccines. The amounts that have arrived so far are sort of very small, being prioritized to healthcare workers and other priority populations. So I am hopeful that things will get better on that front. But what's also more exciting, or as exciting really, is the effort by the Africa CDC to enhance production of vaccines on the continent. Up to 99% of all vaccines, not just COVID, but other vaccines used in Africa are actually imported. And there is a serious effort led by CDC and many countries to enable local production so that that is not a problem for the future.
Absolutely. And I have to mention, I mean, I reported on a couple months ago of a pharmaceutical company in South Africa, Aspen, that was working with Johnson & Johnson to help manufacture locally, at least to some degree. And I know they've been working closely with the African Union to make sure that that also helps increase vaccine availability in the continent. And it seems like finally some of those first doses will be distributed. But kind of, given what you mentioned, 2022, I mean, I've lost a sense of time a bit with COVID, but, that's a bit a ways away. And it seems like globally, a lot of countries have hinged their unlockdowns or going, loosening up based on how many vaccines are available or how much of their population has been vaccinated. So if we're looking at 22 for that type of, vaccination statistics, between now and then, I imagine there will continue to be closures or discussions about closures, lockdowns, etc. For you, what is kind of the balance between those policy measures and kind of trying to mitigate the impact of those measures on education, on healthcare, and some of the other things we talked about?
It is a balance, and many countries are sort of struggling with that, and it varies really what the right decision from country to country, and sometimes within a country. But a number of issues. One is clearly focusing on vaccination is important, even though it is a challenge. It need not be 20 or 30% by mid-2022. It could be much higher as vaccines become available, and they can become available. Thanks to Africa CDC, to the work of WHO and the COVAX, and the support of the US and other governments that are trying to advance that immediate delivery of larger amounts, I'm hopeful that that will be the case and vaccination will be much more available, because that's really the ultimate solution. As we have it in the US and other settings, that is absolutely paramount. With that, there are also other efforts that countries are working on and need to do as vaccines become available, really the delivery of those vaccines, being prepared to distribute these, the optimal cold chain that is necessary, the healthcare workers that can adapt the experiences from a massive experience with immunization in children to adults, to putting in place a communication strategy that addresses potentially some misinformation that is available. And unfortunately, Africa is not immune from some misinformation that is prevailing around potential concerns around the vaccine. I would say that's not really a majority of people, but it is still about 20% or so of the population need to be convinced that this is important and be able to access the vaccine once it's available. But you're right, until vaccination are available, many of the other prevention strategies can and should be put in place, coupled with some safety nets that enable enable communities to withstand some of these closures that are being put in place.
Great. Well, thank you so much, Professor, for this great discussion. Of course, we could go on and on. Big continent, big impact of COVID, but let's conclude it for today. Thank you, Wafaie, for fielding everyone's questions. And just a reminder, this Q&A has been jointly presented by the Forum at the Harvard T.H. Chan School of Public Health and the World from PRX and GBH. You can view the full discussion on the Harvard Chan YouTube channel and on our Facebook pages at Forum, HSPH, and PRI The World. Thank you, everyone, for joining us today.
Thank you, Halima.